It's important for students to know about quality improvement because they go on all the different placements, so they can see what's going on out there in clinical practice at different times and in different places.
Students were coming to us demanding, if you like. They were experiencing quality improvements in action on placements across NHS Wales, and coming back into the university, if you like, into the classroom and saying, they're doing this, that and the other. So they're working on a skin bundle, or they're working on something to do with falls prevention, and could we sort of, teach them a bit more about that, or they'd heard something about a driver diagram or a PDSA cycle.
The two-prong approach is about looking at how we embed quality improvement in the curriculum, and they actually have to write about quality improvements and how they can improve patient care. And the other side of the prong is that very early on now, from induction, they see and they hear about 1,000 Lives Plus initiatives.
The problem I was seeking to address was the dementia patients on a ward who were increasingly agitated, with dementia patients being on the ward now that shouldn't really be there. It's not an ideal environment for them. You are noticing increased aggressive behaviour, agitation, wandering behaviour, and then that inevitably puts the patient at further risk of falls or being lost on the wards and putting them in danger. I trialled it out. It was actually because of a patient that I trialled this out, that I met on my first placement as a student nurse, and it worked very, very well. He enjoyed it, and obviously, that's beneficial for everyone concerned. Yeah.
I think it's a similar focus around having two roles as a student almost. Get your degree, do fantastically well educationally because it's good for us as universities and for them, for their career prospects. But the other role is to try and improve the work that they do, to be a better nurse or a better dentist or a better doctor or whoever they are.
What surprised me the most from the students is their sheer motivation and their enthusiasm to be involved in quality improvement.
The problem I was trying to address through the abstract and the poster was that I was an inpatient in hospital very early on in my nursing journey. I was watching television at 2 o'clock in the morning, and an adult nurse came up to me and told me off for watching TV and was told basically, turn your television off and go to sleep, young lady. I'm 33 years of age. I don't need telling off. I needed somebody to sit with me and talk to me. Had she taken the time to get to know me, she would have known that I'd lost my grandmother 2 days previously and lost my mother-in-law 3 weeks prior to that and wasn't sleeping and just needed someone to sit with me and talk to me. I realised early on that patients come into hospital with two bags. They come into hospital with a physical bag with their belongings and their personal possessions. They also come into hospital with an invisible bag with their thoughts, feelings and emotions. 1 in 4 people in the UK is affected by a mental health issue in the course of 12 months. It's designed to break down the barriers that people do need to talk about and do need to be aware. It's also designed to get mental health problems talked about, faced and dealt with, not just the medical problem on the ward.
There's some great examples of students taking on ideas and translating the theory, if you like, of quality improvement into action around issues such as hydration of patients. Some nursing students in Cardiff, for example, have really focused on measurement of things like fluid intake, so making sure that the right patients are being measured for the right amount and they're actually hydrating properly. So keeping an eye on monitoring these things and measuring those things has proven to be successful in the work that they've done.
Quality improvement has allowed me the opportunity to look at things that needed changing, given me a process by which to follow in order to make the changes. It's a structured pathway by which that everybody is working towards the same aim, and it's allowing me to hopefully make these changes as a student nurse, which previously it was an idea that was lost.